Bridgend Care and Repair has been operational for the last 30 years. It provides services to enable older and disabled people to remain safe and independent within their own homes. When a GP refers a client to Care and Repair, the client is initially seen by a caseworker. Once the client's been assessed by the caseworker, they're referred on to one of the team, which could be the handy person, the occupational therapist, or the technical officer.
When I receive a referral, I make an appointment to visit the client in their own home, and I go out and do a holistic assessment, looking at the person and what they want to do, their physical and cognitive functioning, and the environment. I have a look to see if they're having falls and what the reasons are for the falls, and then I make the necessary recommendations.
The service started off when Care and Repair presented to the West Network, and the cluster decided to take it on as a pilot for a year. So this started last May, and it's been so successful we've actually agreed to continue the funding.
It's reduced our calls, whereas before our patients maybe were depressed, falling all the time, taken to their beds because they were terrified to get out and they were terrified they were going to fall. The service has actually gone in and done modifications to their home. They've maybe put in level access showers, or where they had steps out into their back garden, they've just put level access like ramp or anything like that, which has given the patients confidence, and it actually has helped to reduce some of our calls.
We have had so far a very good response from our elderly population. Quite a lot of them have found it very useful, and it has really lessened the impact on the surgeries as well. There are a few less contacts made to the surgeries from the elderly and frail people especially.
It's improved the methods of helping patients for us and supporting carers as well is another important thing, because carers are often under a lot of pressure. It's meant that we've got a one-stop shop. So rather than trying to find somebody who would support with benefits, somebody who might support them with, adaptations in the home. In the past we would look at a number of different organisations. Now it's just one referral and everything is done, so you haven't got to chase around, so it's much quicker and it's a much easier process for us, and it's really alleviated the time and effort for the GPs and the staff.
I was introduced to Kay, who was an occupational therapist, but through my local GPs. The Sarah, who is the practice manager, she rang me and told me about Kay and Care and Repair then. But Kay came to see me. We made an appointment and Kay came to see me, and it was before I'd actually seen the Parkinson's specialist then to start some medication. So Kay came up and we had to talk, we had a chat, and just talked about different things and what she could help me with the Care and Repair case then, and as an emotional backup as well, because I was quite distressed and I was not in a very good place because of the diagnosis, and it's a life-changing thing, and I didn't know which way to turn really.
I was told on the Tuesday about Care and Repair, and on the Wednesday I had a phone call off Jane, and she was introducing herself to me and what Care and Repair was all about. I had a problem with numb feet and hands, and I found it very difficult to be, I wouldn't go up the back garden because I was afraid of falling. But Care and Repair put a handrail up there, so now I can go out into the garden and enjoy the sunshine.
Well, the two girls from Care and Repair have been very, very helpful. They've given us advice on things that we are entitled to, and Kay has given advice on what things we can get around the house to help, living standards and things. Very, very good. I can't thank the girls enough.
After referring from the surgery, made the appointment to come out and see Liz. We went through our assessment form to identify areas that where I could support and signpost, or just take action as needed. And obviously, as a result of that assessment, I could see that she needed different adaptations put into place in her home.
I've got a thing for the bath, which is absolutely terrific. I sit on it and it turns me round and I can have a shower. Whereas before, well, John would have to be there. Because when you get immobile, you lose the confidence. And I'm scared to death that I'm going to fall.
Kay helped me with, because I'd applied for the personal independence payments. Sent off all the forms originally, and when they came back then they'd only given me the standard rate. Kay wrote a letter for me then to send back with it, to appeal it, and other information I had to send back as well. And they changed that then to the enhanced rate then, so for the mobility and for the care. So which was a great help then.
I came back a few times after that because there were other things that Liz needed. Attendance allowance was the biggie. She wasn't in receipt of any disability benefits at all, and really and truthfully she was finding that it was harder. She was staying in her home more and things like that. So we completed the attendance allowance form between us, sent it off, and after a number of weeks then she had the notification to say that she had been awarded the full rate of attendance allowance.
Well, it certainly made my life easier, but it's made my husband's easier because of what I've been given. It makes me more independent. My poor hubby is waiting to go in for a knee op. So, you know, he's struggling himself without, and you don't like to put on that because it's not fair. You know, the more independent I can be, the better. I've seen two boys. One boy built a step out the back, and brilliant, absolutely fantastic workers, right? They were so clean, because sometimes you get a worker in and it'll take you twice as long to clean up after them as it is the job. But these boys were terrific.
Hi, my name is Ian Humphreys. I work for Bridgend County Care and Repair. I'm a handy person and a home fire safety officer. I do a variety of work, anything from fitting handrails on staircases to facilitate clients to go up and downstairs easy, grab rails by the toilets, all sorts of general work to make it safer and easier for the clients in their own homes. I like to see a smile on the client's face. If I do a good job, they're happy, they feel safer in their own home, and it just makes them feel happy. It makes me feel happy because I know I've done a good job and it's very rewarding for myself.
I love my job because I get to meet so many people, and sometimes I'll go in and they're struggling and the families will be in crisis, and then you put your intervention in and all of a sudden they can manage, and the families are just so much more relaxed. And just looking back then, seeing the difference is absolutely amazing, knowing how much you can help them.
But I'm really grateful that they're there and they're doing this all for me. It's making such a difference.
Well, to know that there's people out there that really do care, and you've only just got to pick up the phone and they're here to repair. They help so much. Jane helps so much in getting me to apply for stuff and have stuff that will help me to live in comfort and secure in my own home, which is the best place to be.